All right, welcome everyone. I'm going to share my screen here, and I'm super excited to get this meeting started. We have Dr. Todd Wendell, and spoke a little bit in the past, but we're really going to dive into GLP-1s and GIPs today. And what we've seen over the past 10 months is we've just seen a lot of doctors very interested in this, and also how to pair our products alongside it. So what I want to do first is I want to start out with just a little housekeeping. Anybody that has not utilized the doctor's reference book, I want to walk you through this just for a minute, just to kind of show you the tools that we have. And so, as you can see on the screen, Dr. Todd Wendell has helped us to really talk through the different products here, and really look at the individual products themselves, the raws, breaking them down and really talking through that process and why it benefits your patients. Now, if you also want to check out the clinicals, you can check out the clinical studies. The other really cool thing is we're putting together a group of, and you're going to hear from one of them today, but we're putting together a group of medical professionals that are doing case studies right now on the products. And so, again, the more material and the more results and the more testimonials that we can accrue, and also to understand different markers, it just helps us really to get out there and be more professional in a field that is searching for this type of thing. So as you guys know, if you've been a part of this, we're always trying to create a clearer message. We're trying to make the tools for you guys as simplistic as possible, but also, throughout the book, you'll see different doctors that are talking and kind of helping you to address some of the underlying issues that we're trying to address with these products, but also just communication back and forth from doctor to doctor or medical professional to medical professional. Those things will consistently change. And one of the things that we're going to simplify is right now we have 3 options. So one of the things that I've noticed in the past, I've been in direct sales since 2007, and it's always been hard to get the medical profession to utilize our products, even when we have really good products, because the systems don't always match with theirs. And so what we did is we came to corporate and we asked them, hey, can we create a couple different systems that's going to make it a little bit more organic to the individual clinic? And so they've given us the option to do that. So if you guys have not watched this, check out the video. It's going to be changing to simplify a little bit, because option number 2 and option number 3 are really the same. They're just different numbers. And so we're going to combine those just to make it a little bit more simplistic as we're sharing that. So you'll see that change in the next month. The other thing that we've done is we've created what's called a customer fulfillment account. So if you want to stock products on the shelf, or you want your clientele to feel, see, and touch it, a lot of times, a clinic will keep something on the shelf, and the first purchase will be through them, and then they go direct to consumer. This gives you the option to do that in something called a customer fulfillment account. Again, it'll talk about it in the video, but this gives you the information to fill out, because you'll have your affiliate account, but then you'll also create a customer fulfillment account that you'll purchase through, and you actually get paid on that as if it was a customer. So you make more money off the shelf when you're selling the products, just to make it a little bit easier for you guys. Another thing that we've noticed in the last couple months is just the opportunity to put up posters that are already pre-made, but we want to make sure that you're able to put your own personal QR code that goes to your store. And so we've created a video that really shows you how to do that, how to drop it into Canva. The posters are already made if you want to utilize those. And then there's a QR code maker in there. So again, just trying to simplify any processes for you guys so that it's very easy to get it up and going in your clinic. Okay, we are going to be talking about this, and I'm super excited about this. We're going to go through it at a deeper level in just a few minutes, but we've created a protocol book. And make sure you guys stay till the end, because not only are we going to be talking through GLP-1s, GIPs, we're going to be talking about how we partner ours with synthetics, our make products with synthetics, and also when you start to taper off of those, how you can utilize that. But one of the things that I'm going to talk about at the end is the actual numbers behind that. And this has been very, very powerful. We've had a teammate of ours that actually brought this to me and just said, hey, I had this conversation with a doctor. I want to share these numbers with you, because as soon as he heard the numbers, it was a no-brainer. And so I want to make sure I'm pointing that out for you guys, but also some of you that want to duplicate yourself. You're utilizing this within your clinics, and you want to make sure that you can go out there and you can pitch it, if you will, to them, and them understand that, hey, this is a very viable source to create some significant income when the patient has left your four walls. And so I'm excited to get through that. A couple more things. One thing we have coming soon. So it's been a little bit tricky to communicate with all of you guys because we're doing it all on an individual basis right now because we're kind of still in that phase of before we bring this out to the whole company, we're trying to kind of work with individual doctors and that type of thing. So I talked with corporate and I said, hey, could we create a platform? Could we create a Facebook page where you guys could come to? We could put all the information in there. You know, it's really great that we can meet once a month doing this, but there's so much more information to give out, and things are constantly shifting and changing a little bit. And you guys have questions, and we just feel like we could serve you at a higher level. So we're going to create a Facebook page. We're actually on our way to a trip down to Texas to do our yearly school down there. As soon as we get back, I'm going to be working with corporate to put this together, and we'll start to invite you guys into that, where we can drop a lot of the documentation and you guys can ask questions, and we can just have deeper conversations in there just between you guys, just between the medical field. Okay, so that's coming. One thing that we're working on right now that I think will also bring a lot of value is a testimonial book. And so we're going to categorize it into doctors that are telling their story, their testimonials on the products, their patients. We're also going to add in gym owners, trainers, nutritionists, and then also just the average person that's getting great results. And so what I would love for you guys to do is, if you have testimonials, whether those are yourself or you have somebody that you know that are getting great results on these make products, make sure they click this button on here and they fill that form out. What we're trying to do is we have tons, I mean, we have hundreds of before and after pictures, but we don't have good context to them. And so we want to make sure that we're doing a good job of understanding what products are they taking, how long was the before to the after picture, were they doing nutrition, were they exercising, just giving all the context so that when somebody's looking at that, it's very professional, but it also is telling a story, and they can really understand how these products, how well the products are working, and what needs to be done around them in order to do that. Okay. Last thing is the DocTalk questionnaire. So if you're a medical professional and you either have questions that you would like to be addressed on here, and or you would love to be a speaker on here, and you have your own testimonials and you're utilizing the make products and want to talk about it, make sure you click on this and fill this out. We'll be checking this every week, but we'll collect them for every single month, and we'll make sure that we're talking about the things and having conversations and bringing the appropriate doctors and medical professionals on here that are addressing the questions and talking about the things that you guys want to talk about. Okay. Write down on your calendar, the next meeting will be the 11th. And then the last thing is, if you guys don't have the book, take a snapshot of this. This will get you guys the book so that you can thumb through that. Here's what I would ask is, for right now, corporate's asking us, give this book out on a regular basis. If you guys have huge teams, don't pour it out to your team right now. Again, we want to work through this and make sure that the book hits all angles before we put it out to the masses. And so right now we're just keeping it within the medical profession. Okay. Before I move on to our first family nurse practitioner that's going to tell, give a testimonial and actually talk about the case study. So we've brought on, like I talked about earlier, a couple different doctors. We've got, I think, about 10 different doctors that are interested in doing this, but we're doing case studies with corporate. And Jamie Edwards was one of those, and she's doing it with 20 different people, but she wants to tell a little bit of a testimonial on her husband. Before I do that, here's what I would ask is, we're going to open this up at the end of her conversation for any questions for anybody that's in the medical profession. Also, as Dr. Todd Wendell gets on, we'll also, after questions, we'll open it up in case you guys want to ask extra questions. Now, if you're in the medical profession, you can ask questions, okay? If you're just a normal person in the business and you're just here to learn, We ask that you hold your questions for a different time. This is just for specifically for the medical people to ask that. And so, Jamie, can I have you unmute yourself and let's talk a little bit through this.
Hey team.
How's it going?
Hey, it's going good. These meetings always make me giggle because they're at my bedtime, but I did
Yeah.
decide to put on a little lipstick for you all so I didn't look like I was dying over here in Wisconsin.
Well,
Um,
you got a good picture on the left side, so you're good to go.
so I'm Jamie Edwards. I'm a family nurse practitioner. I've been practicing since 2015, launched my private practice in Wisconsin in 2021, and just a few weeks ago we got independent practice. So we're over here celebrating that in Wisconsin. So um, typically I practice general like Western medicine, see people 3 months and up, and then the last couple years have expanded my practice to a lot of metabolic health, a lot with weight loss, a lot with lifestyle modifications and coaching. And so this was a natural fit for me. But my topic for tonight is yes, I'm very blessed and grateful to be chosen to be part of the trial process. So yes, as Nathan said, I have 20 participants on the trial, and what that looks like is they are on fit and lean, and they have to have an inclusion criteria of a visceral fat greater than 125 and no existing metabolic disease such as type 2 diabetes at the start. And then we do a lab panel, an in-body scan at ground zero, 3 months, and 6 months. And so we're 1 month in. Most of my trial people are 1 month in. I have a really nice variety of people, some of them on GLP-1s, injectable GLP-1s, some of them not, some of them exercising, some of them not. And so I'll be getting my final two started tomorrow. And after that, it's just clear sailing and data collection. So it has been a little bit exhaustive. It was a little bit more than I expected, to be honest, but that's my general character. I just kind of jump in and do things. But a lot of teaching, a lot of coaching, a lot of educate, just so much. And so that's just part of what we do. But the what I wanted to review tonight is my husband, and his story is almost 43-year-old Caucasian male, no medical problems. Like many of us, kind of let himself go over the last couple of years. I did have him on tirzepatide for almost a year, and he had lost about 60 pounds. I was cycling him off anyways when I got introduced to Make Wellness, and I got super excited, of course, for our personal story with this. So I think Nate was gonna, were you gonna put up? Okay, good. They're there.
Yeah,
So
right in
the
here. I
oh,
can make it a little bit bigger too.
I didn't see those little pictures you had of us.
Oh
Look
yeah.
at
Oh
that.
yeah.
That top one, I was the star of a music video. That was me as Sunshine in a bluegrass music video. So how about that?
Oh, that's
Uh,
awesome.
um, the the scan on the left, so these are in-body scans. Highly recommend this piece of machinery. I call it a bougie scale. It has literally set my practice apart by miles from other wellness practices. The scan you're looking at on the left is from July, so that's just before I took him off the tirzepatide. And if you look to the part that's circled there, that's his visceral fat. So we teach that we want the visceral fat under 100. He was at 132, which made him a great candidate for the trial. So I was a little bit excited about that. So when we review these, we're highly focusing on the visceral fat because that is one of the measurements that we're taking close note to in the study. So about this scan was July 7th, August 1st. So he'd come off the tirzepatide around that time. And then August 1st, he started the trial with fit in the morning and I'm sorry, lean in the morning and fit before his first meal. And he didn't really change that much. He had already implemented a good exercise routine. About 2 weeks ago, he changed that routine up, but still exercising 3 to 4 days a week, where before maybe it was more like 2 to 3. So he maybe did ramp up his exercise a little bit. But and the other piece of the puzzle is he did do the 5-day lean that is offered through the Make Wellness group last week. So, and he did tell me he lost 8 pounds during the lean. So I thought, or the 5-day um,
The
lean.
body burn.
Yeah,
Yep.
yep, the one
Yep.
that's provided through
Okay.
the program. So,
Okay.
so that's super cool. So we do have to incorporate that in there, but that's not going to change his visceral fat in 5 days. So if you
Yeah.
look over to the scan on the right, you'll see that in since it's about 6 weeks, his visceral fat has gone from 132 to 111, and this was jaw dropping to me. This is in my normal clientele for weight loss that would take 4 to 6 months pending their, the efforts that they're putting in while they're on their GLP-1. So this was really, really jaw dropping. The
Wow.
next section is a muscle fat analysis, and these measurements aren't really part of the trial, but I want to prove a point here.
You want me to go to
His
the next screen that has the different circles?
Oh, sure. Is there a
Okay.
next screen?
Yep.
Oh, yeah, yeah, that one. That's awesome.
Okay.
So,
Okay.
yes, that section, the top measurement is weight in pounds. So he was 251.9 in July and 245.9 on the second. So 1 month into the trial. So that's also pretty impressive. Knowing 8 of that was during the 5 day thingy majingy. I'm not getting the name right on that.
The body
um,
burn.
the
Yeah.
body burn, five
Yep.
day body burn, which is super cool if you haven't done it. I also did it and am not on a weight loss journey. And I also lost 4 pounds of just inflammation and crud. So that felt
Well,
really
that
good.
also brings up a really good point. I never even thought about putting the body burn into this booklet because we have it in the fitness one, but
Mm.
we could make a section and put it in here as well so that doctors have or the medical profession has the opportunity to utilize that too.
I would, and I plan to use that as a
Yeah.
jump start, or like almost a requirement before people. I have a whole program that I'd be happy to share with at some point, but I think it
Okay.
would fit in there really well.
Okay.
His skeletal muscle mass, you guys check this out. In 6 weeks, he got stronger, but weighs less. So his pounds of muscle went from 111.6 up to 114. So how cool is that? And then the bottom one there in that section is pounds of fat mass. He had 58 pounds of fat mass in July, and that's down to 48.1 pounds of fat mass in September, a month in on the products.
Wow.
So by and large, those are like the coolest sections that we use. The next one, everyone's familiar with the BMI. If you don't have a body composition scanner like we do, that's kind of what you're using. To me, now that I have my body scanner, it's annoying, but his was 33.8. He's down to 33. We got a ways to move that, but that's why I don't like it. It's so hard to move the BMI while these other things are moving miraculously and just bring so much joy to people to see something move. Um, but look at his body fat, you guys.
Yeah.
Went from 23.3% to 19.6%. Again, I literally had like tears of joy when I was looking at this scan. This is my husband of 20 years, and this is the healthiest I've seen him in probably 15. So it's just really cool to see the objectives paired with all the subjectives that I see with him every day. I mean, his energy, he's coaching football, we're raising our 5 kids, he's helping me run our business. It's fall hunting here in Wisconsin, just all the things that he's doing with a hop in his step over the last month versus kind of dragging around over the years in past. So
Well, and I think
um,
something to point out, again, you just had taken him off synthetic, right? And then
mhm.
into this. And so you would think that he would rebound because he wasn't taking the fit prior to that to maintain lean body mass, but it shows how powerful that is just in that short period of time.
Yeah, agree. Granted, we had made a lot of diet changes, so I think, a lot of his cravings and choices had been, but that's the whole point of it. If you're on a GLP-1 and you're making the changes along the way, then weaning off and coming off is easier. And then now that we have these tools alongside of them, um, I'm just blown away. And I'm just so, so thankful to have the man back. So it's just pretty cool. And again, I could nerd out on the scan all day long, but just if
Mhm.
you'll notice on the bottom, it's really cool because it trends your patient's data over time. And people like these graphs a lot. They can kind of see where they've been and make a goal, for where to go. The other part that I really love about this scan, and I use all the time in my coaching, is over under research parameters. It gives the basal metabolic rate. And we teach on that so much on how, we want to keep that number high. We don't want to crash that BMR because that's just less food you get to eat and that's hard to sustain and all of those things. And patients really like to learn about the BMR for some reason. That's a click for them. So
Yeah.
This is all part of our study, along with a nice little lab panel. So I don't have any labs back because we're only 1 month in. But in another couple of months, we'll have labs with the in-bodies, and we'll just have some great, great data from our, I have normal people on this, on the study, a really nice variety, normal people. So we should have a nice variety of data.
Well, thank you so much for sharing that, because these types of stats and walking us through that, I mean, it just shows how well this is working. Does anybody in the medical profession, does anybody have any questions based on any of that stuff that she talked about? If so, go ahead and take yourself off mute.
Jamie, what labs are you doing as part of the protocol?
Yeah, so I believe I'm going to write them out as I'm talking because I'm visual. I think it's a CBC, CMP, A1C, insulin, CRP, 1, 2, 3, 4, 5. I think that's it. I think it's a 5 test panel that we're doing.
Good.
Thank
Anybody
you.
else? Any
You're
questions?
welcome.
Okay. We will move on. Thank you so much. I
My
appreciate
pleasure.
so much being a part of this. It's just, it's so special to this community. So thank you. All right, you guys. So we're going to dive into our main topic today, GLP-1s, GIPs. We're going to talk about, the support products, Fit, Hydrate, and Calm, why those fit into this. We'll have a little plan at the end as well. And then how do we start to bring in the lean? I wanted to throw these stats out before I bring on Dr. Todd. And I brought these up last month, and it just blew me away when I was looking them up. Is that 1 in 8 in the United States right now? 1 in 8 adults are either on one or have used a GLP-1 GIP. That's 12%. That's crazy. But what even blew me away more was, like, once you get the age bracket up between 50 and 64, it jumps up to 20%. And so I think it's very important. We're going to have different types of medical professionals on here, and I've talked to them all. I've talked to some that they don't believe in them, the GLP-1s and the GIPs at all. Some of them that are totally for it and they have a thriving business, and then some that they use it, sparingly, or they use it in microdoses. And so we're going to talk through all those different scenarios. And again, everybody is, we're good with anybody's opinion. We just want to educate so that you guys can utilize the products how you see fit. So with that being said, I'm going to turn this over to Dr. Todd and kind of release you a little bit, let you get going on the information here, and then I'll interject as we go.
Release the Kraken.
I was gonna say that, and then I held back.
That's all right. I'm a chiropractor, so that's what most patients say anyways. I appreciate it, man. And Jamie, that's awesome. And it's really actually just a perfect segue, because you were mentioning some of the blood labs and what you're seeing in front of you. If you can click on it, zoom on it, and want to walk you through this. A little bit of my background. I've been a chiropractor since 2003. So 22 years in practice now. We specialize in structural rehab. My undergrad training was in strength and conditioning, athletic training, so taking care of sports injuries, and then working with sports teams for strength and conditioning. So just been in the industry since 1996, and different ways, opening my own personal training studios to going back to school, learning more, and just navigating through this. I've seen trends. I've seen trends for a long, long period of time. But for time's sakes, flash forward about 6 years ago, we started to integrate, and one of our doctors was out of Las Vegas, Dr. Graham Simpson. He calls me, and he runs a company called Longevity Medicine, and his company that he started to do was Live Under 5. That was Live Below 5. It was his company, which related to the A1C concept that there was this growing trend of insulin resistance and growing trend of diabetes, diabesity, literally, that was brewing, and you couldn't take care of a patient without addressing these metabolic issues. And so he called me and he says, I have this thing. It's absolutely phenomenal. I'm going to send you some. I want you to try it. And then if it makes some sense, we'll start working with some patients on this. And that was semaglutide. So your original GLP-1s. We saw incredible results with it. But we didn't follow a lot of the patterns. And this is kind of where my natural flair came in understanding lowest effective dose. Could we get, and that's, I think all doctors would agree that if you can get a minimal dose and have the effect that you desire, that's good medicine. I mean, medicine can be healing, it can be poisonous. It's all about the dosing. And as Nate mentioned, we're going to talk about that today. But I'm always one of these guys that's like, I want to know. As Nate mentioned, 12% of the population, I think that works out to about 15 million people that are on these GLP-1s. So you're, and 20% that, in that age range, obviously grows that number. 74% of our population is dealing with some sort of chronic disease. And so we are going to run into these people. And when I had conversations with Nate, I'm like, you're going to run into people that maybe want to do the make, but they're on a GLP or GIP, tirzepatide or semaglutide. And so why don't we figure out a way to parallel this? Because if we can extend their dosing, lower their dosing, extend that, and then come alongside with this, the ability to implement lean and fit and even hydrate and calm and have that lower dose even go lower. And then the greatest thing that I've ever seen with working with patients is creating a map, journey map. Where are they going? And having phases, because we all know it. If you don't map that out, they'll go somewhere that will. I mean, they'll disappear out of your four walls and you're wondering where they went and how are they doing. But if we set a map out there, essentially walking people through this journey, so it's like, hey, when you get here, that's why I love that the InBody scan. We use one through RJL. I like the InBody scan data, Jamie, a lot better. RJL is just a bioimpedance, but we get some data, but it's not as pretty as that. I like that. But when you're mapping that out for people and showing them their checkpoints, how they're doing, they're progressing, and then they know where they're going, i.e. we're going to show you some tighter schedules and some unbelievable ways that we can actually decrease that dosing while we parallel with some of the Make Wellness peptides and then create a longevity. I think it's one of the greatest things that we can do for patients. And when we're decreasing that dependency on the injectables while increasing, a healthy bioactive plant peptide and creating a long-term customer, so to speak, but also long-term longevity type of benefit. So this is so again, where I come from on this, I want to dive in. I'm like always searching for ways to understand like why, yeah, I get it. If somebody's obese, they have that extra weight, every extra pound that they carry is 6 pounds on a joint. But why is all this other stuff going? And in my doctorate work, there's a professor I had, he teaches all over the country by the name of Dan Murphy. And this was like 2001. We had a class and he was talking about this weird phenomenon of what we were calling cell inflammation or insulin resistance. And this is where blood sugar was high and insulin was high, but they're not communicating. They're not binding together. And that's as far as we really got. And like literally protocols were like omega-3s to make the cell membrane a little bit more pliable, be able to bind with receptors or adapt to its environment. And so, yeah, we target it that way. But it wasn't until probably about 4 years ago I came across this. This is I got to give him credit. He's a phenomenal researcher, phenomenal book. This was Dr. Alex Vasquez. This textbook, if you guys don't have it, you need to get it, but it's the Textbook of Clinical Nutrition and Functional Medicine, Volume 1. It is a Bible. It's a book. And about halfway through this book, I come across this pathway that I'm showing you here. And I want to walk through this today because this explains exactly why we're all here and why our patients are in the position that they're in. And I love this. And so if we look on the, it's my left on that, the green boxes, okay? This is what gets us into that orange box. So we explain that orange box real quick. Exaggerated postprandial, so after we eat, hyperglycemia and elevated serum insulin. So that's our high blood sugar, high insulin, right? So if we look at the green boxes that lead to this, of course, inadequate physical exercise, where they're starting to get sarcopenic, inadequate antioxidant, so we're in an oxidative state, receptor insensitivity, that's that insulin resistance I was talking about due to that oxidative stress and inadequate omega-3 fatty acid intake. If If you guys have never come across the book, The Omega-3 Connection, it's an older book, great read to talk about the levels of America's, we're supposed to be in that 6-to-1 omega-6 to omega-3 ratio. He was way back, this is probably 20 years old, was talking about the average American diet was upwards of 40 to 50-to-1 of omega-6. So that's because your McDonald's cheeseburger is all omega-6. You got beef that's fed omega-6, your grains, the bun is omega-6 plus sugar, the cheese is omega-6. I mean, so we have this this growing receptor insensitivity because of the lack of those healthy oils. Further down, excess dietary calories, of course. We're consuming more food that is less calorie dense or more calorie dense, but less nutrition. And of course, we're in that fat and sugar realm. There is going to come out, and I love this too, genetic predisposition in some people. Some people are GLP deficient? Is it more chemistry that's happening in the world? Is it, pollution? Is it environmental stuff? Is it stress? Is it, there's a lot of questions that come into that may lead somebody to be deficient in that GLP. But this is, kind of all inclusive. And then lastly, the micronutrient insufficiencies, such as chromium, selenium, magnesium, calcium, and vitamin D. Again, getting to that orange box, I'll just walk you through this: exaggerated postprandial hyperglycemia and elevated serum insulin. So that's your A1C in a way, that's your insulin resistance. And the crazy part of this, you don't get to choose this pathway. The patient doesn't get to choose the pathway. It doesn't mean that they just go down to the red boxes, which will go through down, or down to these yellow boxes. They go that pathway, both pathways. So if we go up to the red boxes, insulin resistance caused by that inflammation, saturated fatty acids, activation of TLO4, endoplasmic reticulum stress, that's your mitochondrial health, that's your aging, everything like that. That adds to, if we go to the right, fat gain and accumulation of pro-inflammatory visceral interabdominal fat. So there's your visceral fat. That's your damaged, body basically trying to put fat where it doesn't belong because it doesn't have anywhere else to put it. And then we go up to that inflammatory response. Okay, so this is your activation of the NF-κB. That's your cytokines, your tumor necrosis factor, everything that causes inflammation, right? So that's your CRP. That's why I love, Jamie, everybody needs to be running that blood lab. We need to be looking at inflammatory markers because it's been in the literature way more than cholesterol that CRP is way more predictive of heart issues, especially inflammatory heart compared to cholesterol plaquing arteries. So if we look at the inflammatory response, you get cardiovascular, inflammatory cardiovascular disease, predisposition for that, and joint degeneration from the inflammation. Inflammation gets stuck in the joint, starts to deteriorate articular cartilage in the joints, and we get this joint breakdown, okay? So there's just no if, ands, or but, this is the pathway. And then of course, how many times have we heard this with patients that it's like, yeah, I want to exercise, I want to get out, but gosh, it hurts, I don't feel good, or they hop on a treadmill, the joints, the knees start getting inflamed, they can't walk well, their heart's taken out of their chest. And so then we get this progressive deconditioning, as he puts in here, physical inertia, right? And then we're just caught in this loop. Now, that's one pathway. The other pathway, going down to the yellow boxes here, is we get this increased production of androgens. Androgens are those neutral hormones that we produce, but in this state of insulin resistance, you get the conversion of those androgens by aromatase. So what do we get? We get high levels of estrogen. Now, if we go to estrogen, estrogen has been linked to pretty much every cancer that's out there, from breast cancer to prostate cancer, colorectal cancer, gallbladder issues, gallbladder cancer. So we know that excessive androgens or excessive estrogen is not a good thing, right? Now, do we see it in the physical body as well? Yes, this is where in men, we talk about moobs, that fatty deposition in areas that we don't want it. Women get similar issues, the fat dimpling, and then of course the deep visceral fat. So I wanted to bring this in because I think it's one of the greatest flow charts that I've ever seen for metabolic dysfunction. And basically we're fighting. We come back to these green boxes. This is the game. if we can actually nutrify people, help them with some of these metabolic dysfunctions, we're fixing this. And this is what initially we saw with some of the GLP-1s in our practice. When we were doing this, we were running blood labs on them, and they're coming back, and we're seeing cholesterol normalized. We're seeing inflammatory markers normalized. They're talking about their joint inflammation. Like, I don't hurt as much. I'm actually becoming more active. And so we know the benefits of reducing that insulin resistance and the basically Xing out of this pathway, of stopping this progression of this pathway, has proven to be one of the greatest things that we see. You know, New England Journal of Medicine was publishing a lot of the heart healthy benefits of the 30, I think it's 34% reduction of massive coronary events. Your MACEs, a 26% reduction of stroke risk. So it came out basically as we were working with some of these GLPs that they could be very, 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 very helpful for altering these blood labs and then altering this pathway right here. I can stop there and answer any questions, or Nate, if you want to comment on this at all.
Yeah, let's open it up for questions. Anybody? And again, you have to unmute yourself.
Hey, my name is Dr. Aaron Chapa. Hi, I'm out of Texas. Do we have, like, does Energize hit any one of these particular pathways? Does Fit hit any one of these pathways specifically that we could just kind of like, I like flow charts like this as well. And then I also like the idea of like, okay, these peptides are so encompassing on a lot of levels. I'm assuming there's a lot of interplay on a lot of it. But is there a way that we could say, oh, Fit really goes after the, NF kappa beta, the inflammatory cascade, and Energize or Fit and Lean together really hits the insulin resistant box. Do you have any like kind of how you would talk to the products in the make protocol and how we would use it in conjunction with your flow chart here?
You bet. Great question. So that flip book that we had, I do kind of I think 5 or 6 different trainings on some of the peptides and describe some of those things. So, for time's sake, kind of cruise through that. I would say the biggest impact is lean, and that has to do with a lot of enzymatic. I mean, so those peptides are going to work in a different way. I know specifically just through some of the research, and more is going to be coming out on the bioactive plant peptides. But we know a couple things of the pharmacokinetics of how these bioactive peptides are working, plant peptides are working. There's an increase of enzymatic activity, but what we're seeing is a lowered glycemic index. So basically it will delay carb digestion, similar to like a GLP-1. And then it extends incretin is the main component that we look at here. And that's going to boost insulin. So we do have a higher insulin. And then of course that enzymatic activity working on a delayed and or lowered glucose response, so blood sugar response as well. And so we know that it's going to have that impact. The other concept is that gut-brain axis. So we know it has activity that's going to work on basically reducing the hunger cravings as well. And calm is actually going to play into that whole mechanism as well. So yes. And then of course we know some of the new research, we all kind of knew this as doctors, right? And then we have to have a study to prove it. But if we take something like Fit, that just the straight facts of Fit and the studies that we have on that of increasing muscle mass or even maintaining muscle mass, we know that muscle is going to be a sugar pump. And so the more muscle that we can either maintain or gain, just like Jamie showed you with her husband, gaining that muscle mass, we're going to have a greater impact in this mechanism, just with glycogen stores, but also being able to filter those sugars more efficiently. And then, of course, increasing metabolic activity, decreasing inflammatory activity, all that type of stuff too. We know muscle is an endocrine organ now, just based on what's coming out and how it works and the impact on the hormonal system, which we're not even talking about here. With the potential. That's why I was the most excited on Jamie's. I was like, I want to see his testosterone. I bet that's going up too, and so those are other components. So does that answer your question or help in the direction there?
Yes, sir. Yeah, I've just noticed that I've been promoting a lot of the fit, energize, and lean as just a, if I had a trio to focus and be most encompassing,
Yeah, so
although
let's do this because we actually are going to be walking through that. We have kind of a plan. So let's walk through all that stuff and then actually let's open it up for questions at the end because I think we'll cover some of that stuff.
10-4, thanks.
Yeah, it's a great segue, Doc.
All right, so let me get to the next page. All right, so let's do this. Let's walk through these 4 questions. We picked out a couple questions that we thought we can kind of educate back and forth on that. One of them, and then we're going to get to, we actually have created a document that walks you through what products are the best when pairing these with the GLP-1s and then after as you're coming off them as well. So let's dive into this first one as we're talking about the glycemic control when taking, both our products and then also the GLP-1s. Talk a little bit about that.
Yeah, so I kind of walked through that, and that was, a perfect question, and a segue to this. So, we know that we know that these bioactive plant peptides will impact that blood sugar system, and some of it has to do with the enzymatic activity as these peptides go through the gut and cleaving some of the chains off and how that works. Some of them even work as a probiotic as well in the gut, which, as we know, has a really good aspects. There's some good studies on different probiotics controlling glycemic control, so to speak, in there as well. But I think going back to the 2 concepts of the extended incretin, which you're going to get that boosted insulin, and that delayed carb digestion that these are going to work on, we're going to see that element of a lower blood sugar. And of course, that comes into, and why I thought this was kind of a great question, because if we're on a GLP, say they're injecting, we know those GLPs, GIPs, are going to have a fast acting effect. So essentially 3 days, fastest 5 days. So if they're injecting on a Monday, it's probably something we want to monitor and make sure that we're not taking the lean until that afternoon, but taking it daily. But as that starts to wane off, that day 3, day 4, day 5, anybody that's worked with people on these GLPs, they'll talk about, hey, that was good for like the first few days, and then the hunger came back. I took it on Monday. By Thursday, Friday, I wanted to eat a whole cake again and go out. I'm like, how about we take it on a Thursday so your weekends aren't trashed, right? So yes, it's gonna work in that aspect, and I think we need to be smart. I'll be honest with this. We don't have the testing on this yet. That is one of the next things that we're going to be doing. I hope I'll be involved in that, because that was kind of my proposition, is that what does this look like? How do we specifically, we have some ideas on this. And as you'll see, as we get to some of those slides, it makes sense. Anytime we're going under the norms and we're in a safe zone, we can play with these things a little bit. A lot of this comes out to just my clinical experience. I've worked with thousands of people on GLPs, and we've gone into microdosing. We've gone into dosing every other week and trying different things and seeing where people response levels are to these things. So we still get the effect, right? We still want the desired results, whether it's weight loss, inflammatory markers coming down, different biomarkers and blood work. We're still trying to get that effect. But what you're going to see with some of our protocols as we use lean in there, there's going to be less dependence on those GLPs.
Okay. We've got about 15 minutes, so we're gonna have to fly through these a little bit faster. Yep. So okay, now flipping the script over to hypoglycemia, what do you say about that?
Yeah, so kind of covered that as well. I think we got to be smart on these types of things and look at, doctors do a real good job at looking at the dosing and can we modify that dosing? Are these people going through elements of symptoms with, fatigue or maybe lightheadedness? The nice part about a low blood sugar is we eat, right? And so we can typically encourage patients along these lines that we come back to good processes of like, hey, you need to be eating and don't stay away from carbs, good, healthy carbs, complex carbs. adding that fuel. Say it's a sandwich that you normally do for lunch. Maybe you hit that at 11 o'clock, you have a couple bites, half a sandwich, and then 2 hours later, we're finishing that. So I think it does two things. It helps them understand a good eating habits by doing this as well, but understanding what a low blood sugar looks like and giving those symptoms, so we can essentially navigate that with them.
That's good. Okay. What about the timing of the synthetics versus taking the make products? Do they impact each other? Do they need to be taken at different times?
Yeah, and this is yet to be determined. I think it's a really good question. And in good science is just asking good questions. From what I've seen, just working clinically with these combinations of this, it can, and that is also a testament to the bioactive plant peptides that we know that it's having that effect, right? And so we got to be really careful with that. What does that look like? Maybe a reduced dose. Okay, so maybe we spread that dose out. Whoever comes up with the idea that, taking a GLP-1 at a full dose just once a week, what about a half dose twice a week? What about a quarter dose 3 times a week? So those are very, very, very safe things that we've actually worked with patients on and see greater results on that. So I think that's something that needs to be explored. And the more that you guys join in on this, work with people on this, I think we'll have more data on that too.
Yeah, and one of the things I'm actually trying to get corporate to do and put on the boxes for especially the lean product is to start with one pill.
Yeah.
And take it with your first major meal, right? And then move to 2 if you need it. I found, because I've been hypoglycemic all my life and I was a bodybuilder, so I was eating every 3 hours, but I would always have to add fat to slow down that absorption rate. And what I was finding is if I took them both at a time at the same time, it was too much for me.
Yeah.
And so, and also to space it out, I noticed that my cravings went way down because I was taking smaller amounts, more often. So I think it's smart to kind of play with that. And I always like to tend to start with the minimal, like you talked about, even with the synthetics, and then start to work your way up from there.
Yeah, and you got to look at some of, like, in your realm, working out as hard as you are. What is the carb loading? What are we doing to those stores right before going to a workout? Might not be the most desirable. I knew that. I've been on the GLP ones, and there was times I had to reduce and space that out because my workouts were just going to crap because it's just reducing that blood sugar load. So.
All right, let's hit this last one real quick before we jump into the products. So synergistic effects and reliable assets right now. Is there anything we've kind of already alluded to it, that we're doing a lot of case studies, but outside of that, any advice?
Yeah, I think Jamie hit that too. I would encourage doctors, to get one of the in-body scans. We're monitoring those types of things as far as changes, as far as blood labs go too. I think this is a really good clinical tool to do that. The CBC metabolic panels is CMP. And then A1C's got to be part of it. C-reactive protein. Jamie already hit these, so that's a great panel. My only addition, I'm adding hormones. We're just having an epidemic of lower hormones with people, so I'm studying testosterone, estrogen, progesterone, testosterone in women, looking at FSH and LH, and watching those things. Thyroid panels as well. We'll include those if it's cost effective for those people. So those are all different things that we want to keep an eye on.
Love it. All right. So let's jump into the protocol book, and you guys, this will be a part, like I showed you at the very beginning. This is now in the regular doctor's reference. It'll be in the back, and so you'll be able to click on this. It's a 3-page document. Let's start with the core product. Just again, walk through the fit. Why is that a staple product, and how would you utilize it with your clientele?
Yeah, so the biggest worry, and I think some of it's unfounded, I think some of it's legit as studies come out, but it's the worry of losing muscle mass. So we got to be realistic. Some of these people have never worked out, never exercised in their lives. They're looking for a quick hit, a quick weight loss. They just want the body type without doing the work type of concept. So when we look at fit, it has to go with anybody doing a GLP-1. I mean, it's just, you look at the numbers here. I don't have to read through them, but accelerated recovery, fatigue, and performance, just the maintenance of muscle mass and the potential of increasing muscle mass is just huge. If we go back to my pathway that I showed you, that oxidation rate, that's it. We're NAD. So if we're elevating NAD by 2.7 times, you're actually reducing the rusting of your mitochondria and that DNA. So it is one of the best things that you can do. I love NAD. And you're reducing that oxidative load. And again, here's your longevity play too. So.
Love it. All right. Two products that I feel like are kind of sleeper products, but I think they're super important. And we've made kind of the decision that we're going to talk about these as being part of that, highly suggested. Will you talk a little bit through the hydrated, which in the video you talk about outside of a drip IV, that this is one of the best products out there. But then also Calm and how that
Yes.
can increase your production.
Yeah, and again, as people, I think one of the biggest components on this we have to understand, if we are breaking down fat stores, we're helping people lose that visceral fat. Fat is our chemistry stores. And I always said the solution to pollution is dilution, right? Solution to pollution is dilution. And so if we're hydrating, we give them something that actually tastes good, they're willing to drink more water, but we're actually adding the components that hydrate has in there. It's absolutely phenomenal. And we're going to help them buffer that. Everybody that's been through weight loss knows that first week where you're bringing those fat stores in, but you're bringing chemistry in the body. And there's a lot of oxidative stress on the body. So dilute that pollution right there.
Mm-hmm. That's awesome. All right.
Calm.
Oh, sorry.
Yeah, Calm real quick too. Just quick. I mean, cortisol, we all know how that plays. And so if we're helping them manage that stress response, that hypothalamic pituitary adrenal axis, you're going to see way better benefits by helping them manage their mental and physical stress. And then, of course, when they talk about their brain fog going away as they're losing weight, getting more muscle, it's just a win-win situation.
Love it. All right. And then the last one, last but not least, lean, and talk a little bit about when you would bring that in and, kind of why it's, the last on the list.
Yeah. So, I would encourage you guys clinically to look at that. I mean, if you're having somebody say on a semaglutide that is at, for lack of different concentrations, say at a 0.5, and they're still not seeing some of the results, it's a perfect time to bring that in. I really do. Instead of titering up or, risking some of the gut issues and the nausea, the gastroparesis that's been associated with this, make that clinical call and bring it in as soon as you can. Parallel them as soon as you can. And then they have something that is actually done daily instead of just that, injection, high, low type of concept. We're actually paralleling and keeping that fire burning, so to speak, over a long period of time.
Love it. All right. And you guys, you can take a snapshot of this. This is going to go to a landing page. And so talk about how you came up with this and just a quick reference to it. And again, you guys can take a look at this at a deeper level outside of here.
Yeah, absolutely. Dive into it and look at it. I just had Grok do this for me. No, I'm kidding. This is just trial and error that we've done over the last probably 6 years with GLPs. And looking at it. And the thing that we have to look at, different compound pharmacies have different concentrations. So you want to look at that. If you have any specific questions, you can message me. I'm all over Facebook. You can ping me there. And we can talk about different dosing if you have some questions on that. But just gives you an overall framework of how we've done it in the past and how we're paralleling basically lean in this case with those dosing and how we titer people off of that dosing. Now, that being said, if you have somebody that is really aggressive, they're just starting this, they really want to get to that ideal body composition, you're mapping this out, you may want to keep them at a higher dose and or that consistent dose until they see those weight loss benefits. But as soon as they hit that threshold of say, hey, I got 40 pounds to lose, we're hitting that 30-pound mark. It's a great time to parallel. And then again, I am big on mapping this out for people. Hey, this is our pathway. This is where we're going. So they have something to anchor onto. like you, doctor, have a plan for them. And that plan is to save them money, reduce the impact of having these injectables. And one thing that I love to talk about, and I don't think it's being done at all, but we'll do this. I'll force people off any of these peptides, not the Make Wellness ones, but if I got somebody on an injectable, I get them a month off. I mean, Nate, you know this from training.
Yeah.
I mean, cross train, let the body settle out, because the sensitivity is going to grow the longer that you're on, or decrease the longer that you're on this. If we can take a month off and then really focus on the lean peptides too, and if we need to, we'll come back in a low dose on this, I think it has a greater impact. We're going to see better results.
Yeah. And that leads me into this. So I want you guys to take a snapshot of this. Well, actually, you can just pull this out of the protocol book, but I want you guys to take a look at this. So this came to me in a conversation with somebody that's in our business. Actually, I'll give her a shout out, Melanie Abear, and she has a lot of conversations with doctors, and so she brought this conversation to me, and I was like, man, this is very interesting, and I need to start to share this because it shows the power of this. Now, you just heard Dr. Todd talk about, getting them off so that they can rest a little bit and allow their receptors to come back. Well, this is a great example of that. So we had a conversation with a doctor, and we asked him, how many injections are you doing? How many people are coming through in a month? And he said 1,500. So obviously that's pretty much all they're doing, right? And so we talked through the products, and we said, if we were just going to make the fit for the sake of this conversation, if we're going to just make the fit the foundational product, how many people do you think you could get to get on the fit, knowing that they need to increase lean body mass, knowing that that's going to help, reduce some of the inflammation. It's going to also help them to increase their metabolism, just help them along the process afterwards. And he said 50%. So I was like, I felt like it's a lot, 50% of the people saying yes to that. But so let's take those numbers, 750 patients. Okay. The product's normally $119, but you get a 10% discount. So it's $107. That's $80,000 you're generating in revenue. Okay. Now that puts you at the 40% mark. So they're making $32,000 alongside their synthetics. Here's the power of this. When they're getting them off the synthetics, they're going to consistently do this product, and they're going to continue to do it because they want to maintain lean body mass, knowing that lean body mass is the fountain of youth, right? That is all the results that they've paid for as far as doing those GLP-1s. If they want to maintain that for a long period of time, then that is a product that they need to be on. And so you're looking at outside of your four walls as a doctor, you're making that $32,000 as generating extra revenue, right? And then, like he said, if sometimes they come back and you're getting them back on because you're cycling. But I think this is a very powerful, just some numbers to throw out there and to really help people to understand, especially, in the medical profession that are doing this on a consistent basis, like how these products could be a main source of income. So I wanted to put that out there. Let's open it up. We're sitting right at an hour, but let's open it up. If anybody has any conversation or any questions, I should say, we can take some questions right now.
I was looking in the chat. I think most of it got answered. Tiffany, with the lean simply one per day, or do you find some other people with insulin resistance need more? Did that question get answered for you?
We're good?
Okay.
Well, that's a good sign. If we've either we've talked too long or we were very efficient. Well, thank you guys.
Hi, this is San Aragon. I'm Jorge's mom. So I was
Yeah.
listening to the, it was very instructive.
Perfect.
Thank you.
You bet. You bet. All right, you guys. Well, we're going to do this once a month. The next one will be posted at the back of the book. And the link goes live the week of. So if you guys are sharing that link or whatever, you can share it the week of. Again, like I said, we're heading to Dallas. So as soon as we get back, we will start to work on that platform as far as the Facebook group where everybody can be in there and we can communicate a little bit more during the month. But appreciate you guys, and we will see you soon. And thank you, Dr. Todd, and thank you, Jamie.
Thanks for having me on. Thanks, guys.
We'll see you guys.
Thank you.